Hi, thanks for watching San Francisco Live. This is Arnel Valle. I'm going to be hosting tonight's nonprofit focus on youth and sex. I'm joined here in the Flash studio with Jackie McWright from the Department of Public Health. Thanks for joining us. And I'm also here with Lonnie, and we're going to be talking about youth and sex in San Francisco. In case you're watching and just tuning in, help me out. Define what is officially youth for the Department of Public Health. What ages?
12 to 22.
Okay. So if you're 12 and between the ages of 12 and 22, or if you know a youth between those ages who might use some services, we have a whole bunch. So get a pen, get paper ready. We're going to go through a lot of organizations and a lot of projects. Let's start off with Jackie. Please tell us who you are at the Department of Public Health.
I am the Community-Based STD Services Director. So everything that we do that involves San Francisco community, I have staff that work in those communities, and we go into unique places. We go to fairs. We might go take our testing equipment out to a bar. We might take it to a barber college. Wherever people are, we provide services, and that includes the jails as well.
Okay. And primarily for STD testing?
STD testing and education.
Okay. And Lonnie, thanks for coming to the studio. This is your first visit to us?
Actually, I've been on several other shows here at the studio, but not in this particular studio. Right. But it's always a pleasure to come down here to the studios and give some information, vital information, specifically to the people of San Francisco.
Okay. And your focus is primarily on youth?
My focus is primarily on youth. I'm the Director of Community Services for the Juvenile Probation Department. I also have an interest in making sure that information is given out to the population of youth at large in San Francisco, particularly as it relates to STDs.
Okay. And again, you're watching SF Live here on Access San Francisco, channel 76 and 30. We're a live call-in show right now, so if you have any questions, you can give us a call. Our call-in line is 415-621-4473. We're talking about youth and sex services for youth in San Francisco. I just want to start off, there's a bunch of organizations and a bunch of projects that are going on in San Francisco. On the first on my list is the San Francisco City Clinic, the STD Clinic. Jackie, you can help us out here. Location here in the city for the STD Clinic. It's on 3rd Street for youth.
It's on 3rd Street for youth. City Clinic is at 3567 7th Street, and that's between Folsom and Harrison, downtown San Francisco.
Okay. And the phone number for the 3rd Street Youth Center is 415-822-1707. Some of the services that they provide are physicals, birth control, pregnancy tests, STD testing and treatment, HIV OraQuick testing, and pap smears, emergency contraception, free condoms, and routine general care. Jackie, can you help us out? What is the HIV OraQuick test?
That's the swab test that you can do in the mouth.
So in case anyone's really nervous about needles or blood.
Right.
And it's a quick test. So quick as relative to a blood draw. About what's the turnaround for getting results?
20 minutes.
20 minutes.
Yes.
Okay. And one of the things about HIV testing, a lot of testing here in the city, there's a difference between confidential testing and anonymous testing. Can you elaborate on the differences between those two?
Confidential testing, you do give us your name and contact information,
right,
so that we can follow up on you if you do come out positive and provide you with information for early care so that you can stay healthy if you do find out that you're HIV positive. Anonymous testing, you do not give your name. And
mostly that's based on a code.
Right. It's a number that you get, and you have to remember that number and bring that with you to get your results. If you do come out positive and you don't show up, you're walking around with it and you don't know it, and we can't find you to inform you and to keep you healthy. The sooner you find out, the better, because there's so many drugs out now, and people are living for like 20 years who are HIV positive. So it's not a bad thing when you get diagnosed positive.
It's actually better to actually know.
It is best to know.
Because it provides early health care, treatment, counseling.
All kinds of other services, support, emotional support.
Something that's really important for youth, because HIV specifically has only been around for, less than 30 years? So it's relatively new. there's been a lot of advances, and getting early testing is always helpful and beneficial.
Right.
For youth, tell me what's the trend now with youth education around STD?
You know, I mean, I think there's a veritable cornucopia of educational brochures and information that's out there. But I think in terms of having it systematically across the board, I don't see that. It may exist, and I may not know about it. But in my travels, I have not seen it. And let me just say, one of the critical things about what's going on, particularly in the city, and when you start looking at talking about the African American community, there's some of the highest rates of STDs in the nation, based on some of the preliminary stuff that I've done in the community around STDs. The other thing is that when you start looking at syphilis and some of these other things, and there's been slight increases there over the years, and Jackie could probably talk a little bit more specifically about that, but just based on some of the epidemiology reports that have been out over recent years in the Department of Public Health, you can see some increases, at least so in early years, and I think it may be on a slight decline now. But I mean, I have an interest because of all the youth that I deal with in football and all these other areas. It's important that these kids understand and get the information so that they can make an informed decision about what needs to happen, as well as their parents.
Mm-hmm. And you talked about epidemiology, which is basically scientific data, numbers about who's getting infected, who's infecting other people, populations, specifically the ratios of African American, Latino,
Correct.
white, Asian.
Right.
Something, again, it doesn't help anybody until you get tested and you know where you are.
Absolutely. And that's one of the problems, too, is just making sure that folks have the courage to come forward and get tested. And so I think that's half the battle, is making individuals comfortable, even if they're not comfortable. Just to
And
the
that's
point
normal,
where-
to be uncomfortable.
Absolutely it is. And I think that we need to make sure that they understand that.
Mm-hmm.
And I think that's part of Jackie's charge and my charge in my travels as well. And the Department of Public Health in general, just to make sure that happens and so at some level.
And for the sake of education, there is no cure. There's no cure for HIV. Syphilis, gonorrhea, sexually transmitted diseases, some of them skin by skin contact. Do you also provide counseling? Something that's absolutely critical for youth. Youth in school, youth without a home, any programs for homeless youth?
There are several programs in your resource list that's for homeless youth. Every place that you go to in San Francisco that serves youth will give you counseling on just about any area that you want. And if they don't have the information, they'll refer you to an agency that does have the information. But there is something funded in this city for everything that a youth may need, whether it's a place to stay, something to eat, counseling, depression, whatever.
Cole Street provides one-on-one peer counseling, from what I understand. The Cole Street Clinic is on Haight and Cole. There's various hours. Phone number for Cole Street is 386-9398. Again, there's a whole scope of services provided. HIV testing, condoms, birth control, primary healthcare services. And also, I'd like to cover this program, the VIP program. That stands for The Violence is Preventable, and it's a program for women ages 14 to 17. Again, a great program empowering young women, 14 to 17. Can you tell me some information about that program?
You know, VIP I've heard of. I don't know specifically about what it is that they do in terms of the program, various program modalities that they offer. I do know that if it's the same VIP program, that Cole Street Clinic is affiliated with them, as well as Huckleberry Youth programs and some of these other ones, and so they act as a feeder base for some of those programs. So they refer to VIP to some for some of these young ladies to that particular program, so that they can get the necessary services, and then VIP, I guess their case managers would follow up, and so that is kind of the extent of it. Because what I oversee as a director of community service for the Juvenile Probation Department are primarily intervention and some prevention programs, but and for the most part, it's intervention programs for kids that are actually on probation.
Okay.